This afternoon. My name is Manny, by the way. I'm a physical therapist. I work for Valley Hospital, inpatient and outpatient department. Today we'll be talking about gait and balance, okay? So our objectives for today, number one, to explain and demonstrate what normal gait is. Number two, explain what affects our gait and balance, exercises and activities for better balance. And lastly, but not the least, is when to see a specialist. Before we start, anybody in this audience have a recent fall or near falls? Show of hands too. Okay, good. And in the Zoom meeting, how many raise their hand? 2 people. Okay. All right. So today our goal would be to educate you guys on how to prevent falls and how to improve your balance, how to improve your gait. Okay. What is gait? Gait is a person's pattern of walking. Normal gait is a series of rhythmical, alternating movements of the trunk and limbs, which results in a forward progression of a center of gravity. It requires strength, flexibility, sensation, and coordination to keep us upright and balanced. Gait is basically, in simple terms, the way we walk, okay? What are the 3 planes of movement when we walk? There are 3: sagittal plane, the frontal plane, and the transverse plane. Sagittal plane is basically, it divides your body into 2, like right and left half. So as physical therapists, we look at how people walk, compare their right side from their left side, okay? So are their arms swinging equally on both sides? Are their legs moving at the same time or equally on both sides? Are their hips swaying on both sides? Frontal plane is basically dividing your body into front and back. So as physical therapists, we look at how people look when they walk in the front and in the back. We look at their shoulders, we look at their hips, we look at their knees and see if there, any deformity or any, deviation in their knees or hips, okay? Lastly is the transverse plane. Transverse plane means imagine you're going to be cut into half, top and the bottom. So as physical therapists, we look at how your upper body is, moving with your lower body, how your shoulder is turning, how your hips are turning, how your trunk is rotating when you walk, all right?
Because the people at home can see all your notes. So I just want to make sure that we're sharing the right screen. Hi, everybody. I'm sorry. I just want to make sure that we have everybody seeing what they should. Okay, that should have done it.
All right. Sorry about that again. There are 2 distinct phases of gait, stance phase and swing phase. All right. Stance phase is the phase of gait and when the foot first touches the ground. All right. And stance phase makes up to 60% of the gait cycle of the walking, okay? Swing phase of the gait begins when the foot starts to leave the ground and ends when the same foot touches the ground. So swing and stance. Now, what are the stages of the stance phase? There are 5, okay? Initial contact, loading response, mid-stance, terminal stance, and pre-swing. Now, when we look at a person or a patient that we're treating, we look at these 5 stages, okay? It's hard for me to walk right now, but because the people from Zoom cannot see me, but I'll show you for you guys over here. That's okay. I will step back. Okay. All right. Sorry. All right. So those are the 5 stages of the stance phase, okay? So initial contact is when the foot touches the ground. Loading response is the period of weight acceptance. Mid stance is when full loading of the single limb stance happens. Terminal stance is when the leg is behind almost into hip extension. And pre-swing is when the leg is preparing to push off. All right. Now we go to the swing phase. There are 3 stages of the swing phase. Initial swing, the mid swing, and the terminal swing. So initial swing is when the leg starts to move forward, hip, knee, and ankle to initiate foot clearance. Mid swing is when the body is over the swing leg and creates foot clearance and limb advancement. And terminal swing is the final advancement of the leg to position the foot for initial contact to start the next gait. In this slide, you will see that in the model, you see the right foot only, because basically when you look at the gait cycle, you focus on one limb. That way you can see the different phases. See on the first illustration, that's the initial contact. The second one is the loading response. The third one is the mid stance. The fourth is terminal stance, and then pre-swing, and then we come to the swing phase, which is the initial swing, the mid swing, and the terminal swing. Right? So as you can see, stance phase makes up most of the gait cycle, which is 60%. Now, in this next slide, I'm going to show you a video. It's a short video, and it will show you the gait cycle, okay? All right, that was a very interesting video. All right, so gait variables. So these are the things that we look for when we look at how a person walks. We look at their arm swing. Let's see if they're even on both sides, all right? Trunk rotation. So sometimes, especially people who have, or patients who have Parkinson's disease, they're very stiff. So they're not moving their trunk when they walk. They're like very stiff, you know? Equal step length. Usually when people have knee pain or hip pain, they don't want to put too much weight on the leg that's affected. So they don't have an equal step length. Consistent cadence, all right? So again, people who have Parkinson's disease, they tend to shuffle in the beginning, and then after they get over the hump of the movement, they start with slowly with their normal pace of walking. Good posture is also one of the things that we look for. A lot of times when walking, when we don't really pay attention to the way we walk and the way we tend to go forward or backwards. But most of the time it's forward because of our tendency to lean forward, especially when our head is forward also as well, okay? Appropriate assistive device when necessary. So we look at the patient if he or she is using a cane or a walker or crutches or any kind of device, whether it's a orthosis for the foot or a knee brace or a back brace, or those things that we look for, which will help them walk better. Good footwear is also one thing that we look for, right? Sometimes when the footwear is, number one, too tight, too loose, all right? What else? Not comfortable for them, too high, yep, definitely. That will affect your center of gravity. If your high heels is too high, because it will throw your balance, your center of gravity a little bit forward. And lastly is environment, okay? So definitely what environment you are walking. Let's say it's carpet, wood, hard concrete floor, or uneven surfaces. So those are the things that we look for. Common gait problems, all right? Number one, neuropathic gait, all right? So this is common with people who suffer from stroke or TBI. TBI means traumatic brain injury. So for stroke patients, most of the time, especially, let's say it's a brand new stroke, it's a very acute stroke. A lot of times, one side is very weak and very flaccid. So they can't put weight on the one side. On the later stage of strokes, usually they become more spastic, meaning their arms and legs are rigid, almost like either in flexion tone like this, or extensor tone, which is super straight, like super rigid. So, and then you can see them walking like this. So those are the things that we look for. For TBI patients, traumatic brain injury, they suffer a trauma to their head or brain. So they're very ataxic. So they're walking like very, very unsteady, and they feel like they're going to fall down all the time. So they're almost like shaking all the time, okay? Foot drop. Patients who suffer from, let's say, nerve damage on their feet, okay? Let's say they have a back surgery and they injure one of the nerves, especially the nerves for the foot. And you can see them, their foot is slapping on the floor when they put their foot down, or they're dragging their foot when they walk, okay? So a lot of times with foot drop, we recommend maybe orthosis to fix that, okay? Bendelenberg Gait. This is common for people who have weakness on their glute muscles, gluteus medius and gluteus minimus, your buttocks muscles, okay? So what happens when they walk, have you ever seen them? I'm sure you heard of Mae West. She's an actress in a long, yeah. So her hips are like going this way, side to side. So we call it the Mae West Gait. So what happens is when they put their weight on one side, and if they have a weakness on one side of the hip, their The other hip tends to tip down. So that's called the Bendelenberg Gait. Okay. Fascinating gait is common among people who have Parkinson's disease. So it's commonly known as a shuffling gait. So what happens with that is with Parkinson's disease, they have this thing called apraxia, which is difficulty to initiate movement. Okay, so they start to shuffle first because they can't get over that hump. But once they get over that hump, their normal phase of gait starts to occur. So they shuffle first. Okay. Myopatic gait or muscle weakness. Most commonly, we call this the waddling gait. Okay, they waddle like that. Okay, so this is because they have muscle imbalance on their legs. So one muscle is weaker than the other, or one side is weaker than the other. So they try to compensate and they waddle. Okay. Now we're going to the balance section of this afternoon. Balance is your ability to control your body in space and distribute your weight evenly in a way that allows you to remain upright. There are two types of balance, static and dynamic. So static, this is static. Once you start moving, it's dynamic, basically in simple terms, okay? So static balance is the ability to maintain the body's center of mass within its space of support, and dynamic balance is the ability to move outside the body's space of support while maintaining postural control. What systems control our balance? There are three: vision, vestibular system, and somatosensory system. All right, so let's talk about vision first. All right, vision plays a major role in our ability to orient ourselves in space and process our surroundings so we can balance during everyday activities like walking or going down the stairs. Vision problems can make it challenging to maintain proper balance. When someone has trouble with vision and the eye muscles have to work harder to compensate for the decreased visual clarity, then eye strain, headaches, and balance disorders can occur. All right. So the visual system is very important. All right. So when we do our testing with patients, one test that we do is we have them stand and close their eyes for a few seconds. And the first thing that we notice for people who have very poor balance, what happens? They start to shake and they start to lose their balance because vision is almost main majority of our balance system, right? Maybe 50 to 60%, I would say. All right. Now, here's the tip. If you use bifocals to read, for your reading, okay, what happens when you walk while you're wearing the bifocals? The ground seems to be a little bit uneven, or you have a little bit of a illusion of the surface being higher than it is, right? So it is advisable if you use reading glasses, all right? If you're walking or going down the steps, make sure you take them off. Otherwise, your depth perception will be kind of like a little bit disturbed, and will cause you to fall down, which we don't want, okay? What is the vestibular system? All right, the vestibular system is a sensory system that is responsible for providing our brain with information about motion, head motor function, head position, and spatial orientation. It is also involved with motor functions that allow us to keep our balance, stabilize our head and body during movement, and maintain posture. Thus, the vestibular system is essential for normal movement and equilibrium. All right. The vestibular system is basically located in our inner ear. All right. So a lot of times, all right, when patients who have vertigo, all right, they usually complain of dizziness, lightheadedness, all right, and they feel like they're going to fall down. So most of the time, it's because of their inner ear. They have either infection or something happened, a trauma, or in my case, it happened to me 2 years ago. I had a fall and I hit my head, and then it kind of messed up the crystals in my ear. So it can happen. So once the crystals move or get stuck in there, you need to see a specialist to kind of like put it back in the right order. Okay. And what causes this? All right, infection, trauma, all right, those kind of things. Information coming from the vestibular system is processed in the brain and then sent to other organs that need information, such as the eyes, the joints, and muscles. This allows us to keep our balance and know what position our body is in. Another common complaints are the room is spinning, all right? So when you have problems with your vestibular system, you feel like the room is spinning, okay? Common diagnoses are benign paroxysmal positional vertigo, right? Or simply vertigo, which can be treated in physical therapy with a maneuver. We call that I forgot the exact term, but I think it's stick spiral maneuver, where we tilt the head and kind of like fix that stuck crystals in your inner ear, okay? And it's usually treated within 2 to 3 sessions, which is, it helps a lot, So another thing is vestibular hypofunction, all right? So sometimes we have 2 systems, so we have 2 ears, right? So sometimes one side is not functioning as the other. So there's hyper functioning here, and there's hypo functioning here. So what causes it? Could be infection, it could be trauma again, all right? So those kind of things. So if you have ear infection, sometimes it happens. So you feel like, you feel like you're unbalanced because of the too much pressure there, okay? Next one is the somatosensory system. The somatosensory system is part of the sensory system concerned with this conscious perception of touch, pressure, pain, temperature, position, movement, and vibration, which arises from the muscles, joints, skin, and fascia. All right, so this is basically the whole body, all right, especially your feet, okay? So your feet gives you a lot of signals, all right? So your feet knows you're standing, your feet knows where you're walking, your feet knows whether you're standing on an even surface, okay? So your skin, your joint, your proprioceptive receptors in your ankle and your foot gives you signals to the brain, so where you are in space, all right? Now, what happens when somebody has neuropathy, all right? Let's say you have diabetic neuropathy or peripheral neuropathy, okay? What happens? There's less sensation on the legs or on the feet, sometimes even numbness on the toes. So what happens? Your brain is kind of like you're trying to figure out where your foot is, or is it even on the floor, or it's not feeling the full pressure of the floor against your feet. So you need to kind of like you have to see first of all, you have to see a doctor what can be done with that one, right? Whether it's diabetic neuropathy, whether it's due to a nerve impingement, right? Nerve damage or peripheral neuropathy can be caused by a lot of things, okay? Infection, spinal infection could be due to a surgery, spinal surgery that gone maybe drastically wrong, hopefully not, but it happens, all right? And then all those factors, add up to you getting less signals to the brain. So you need to address that, okay? Now, other factors that affect balance, all right? Number 1, lack of flexibility or range of motion. Let's say you have arthritis of the knee and the hip. What happens? Let's say it's one side only. You walk uneven, right? So you start to compensate one side more than the other. You start to put more weight on the left side. So one side becomes weak, and then one side becomes tight also at the same time. So you're uneven when you walk, you're uneven when you stand, when you're uneven when you move around. So that affects your balance, definitely. Weakness. Let's say you have stroke, you had a surgery, a spinal injury, or a back injury that has lumbar radiculopathy. You have pain going down the leg, and then you have nerve damage on your legs. So you will have weakness on your legs. So when you have weakness on your legs, you're definitely unable to, put enough, you don't have enough muscle strength on your muscles to hold yourself up, all right? Injuries, whether it's leg injuries, definitely, or brain injuries, correct? Yep. Yep. TBI is number one, concussion. Yep. All right. Pain, similar to the first, injury. So you have pain in the legs, pain in the hip, pain in the foot. All right. You have arthritis. It throws your balance off because you're trying to avoid the pain. What happens? You kind of like throw yourself off. You throw your balance off, throw your walking off, and everything. Orthopedic issues and surgery. All right. So if you have hip replacement or hip surgery or knee surgery, ankle surgery, all of those will definitely throw your balance off in the way you walk. Neurological disorders, like again, stroke, traumatic brain injury, those kind of things. Neuropathy, diabetic neuropathy, those kind of things. Cardiovascular disease, if you have peripheral vascular disease, if you have swelling in your legs because of the heart condition, whether it's congestive heart failure, whether it's peripheral vascular disease, and you have wounds on your feet, or a severe swelling on your legs because of poor circulation, it can affect your balance. Because number one, when you don't have nerves, is basically dependent upon your blood supply. So if you don't have blood supply on the nerves and the legs, what happens? Number one, you will have numbness, all right? So you don't feel your legs, and that will throw up your balance, okay? Exercise, this is the fun part. This is what we do as physical therapists. We teach patients how to improve their balance through exercises and activities. So these are a couple of sample exercises that we usually do. Notice that all of the exercises in the picture here, the person doing the exercise is holding onto something sturdy, okay? So make sure when you do exercise or balanced exercise at home, make sure you hold something sturdy. I usually recommend the kitchen counter or the kitchen table, something sturdy, okay? So the first one on the extreme right is standing hip abduction. So she's holding the chair, she's doing this way. Why is that important? Your hip abduction muscles, we call it the gluteus medius and minimus muscle. That's important for you to, when you stand up from the chair, when you go up and down the steps, that will help you, okay? If that is weak, what happens? You're gonna have a dip in the Mayweather Gait again. So you have to strengthen that hip abduction muscles or the gluteus muscles. The second one on the right, the lower right side is heel raises. So basically when you do that exercise, you strengthen the calf muscles, okay? So why is that important? Part of the gait, remember when we explained earlier, when you hit your heel on the ground, the heel strike, you have to have good strength on your calves to hold your foot before it starts to move forward, okay? So you have to have good strength in your calf muscles, all right? The third one in the middle is just marching in place or standing in one leg, okay? I think she's standing on one leg, but I don't recommend this without holding onto something. Make sure you hold something sturdy, okay? What is that good for? It's a challenging exercise for balance. So it kind of helps, again, same thing with your hip abduction muscle, your glutes, it helps strengthen that muscle, okay? Now, the fourth one on the left side, when she kicks her foot back, that's for your gluteus maximus muscle. That's part of the gluteus muscle. Same thing. When you do that exercise, it's very good to strengthen that muscle, because that's the muscle you need for when you try to get up from the chair, when you go up and down the steps. Okay. Now, the last one, you see she's doing some arm exercises, right? Why is that important? All right. Part of the balance is not just the legs, okay? A lot of times we do a lot of upper body exercise or upper body activities. You're trying to reach for something on the shelf, right? You're trying to reach for something in front of you. All right. So when that happens, your body should be able to adjust and adapt to changes in your center of gravity. So including the arms is good when you do your balance exercises, okay? More activities. This one is more challenging and more advanced. So the first one on the right is simple sit to stand. So in this picture, she's not holding onto anything. All right. So she's basically sitting and standing from the chair. So why is that important? All right. Number one, for your glutes again. And number two, for your quads. This is your quads. All right. So the quads muscle is very important for walking, again, for going up and down the steps, and also from getting up from the chair. Okay. So now this exercise, I recommend that you do this with an armrest, and if you're unsteady on your gait, push from the chair instead of not holding onto anything, or have somebody in front of you or a chair in front of you. Okay, so when you do this at home. The next one on the lower right, she is standing on a foam right now. All right, so basically that's a balancing activity. Basically, she stands on one leg on a foam, and what it does, it challenges the ankle muscles, all right, the leg muscles, on kind of trying to find the balance, okay? Because when you stand on something soft, let's say a foam or a pillow or something, but you know, your ankle will be uneven, your foot will be uneven, so it kind of challenges your balance, all right? All right, so when you do the same thing, you have to do it with something, you hold into something sturdy, okay? Right, next one in the middle, he is walking sideways like this. All right. Why is that important? All right, again, for your hip abduction muscles, your glutes again. So you notice a common denominator in our exercises, it's your glutes. Your glutes is the very important muscle, all right? It's not just a cushion for sitting on your couch. All right, so the next one, on the left side, the far left side, he's doing the figure of 8, okay? This is more advanced, okay? So why is that important? Because sometimes some people have difficulty with the coordination, all right? Or, you know, they crisscross their legs or they on their feet. So trying to orient yourself in space is good. You know, it's a good challenging activity. Again, when you do this, make sure you hold something like a wall or something close to a bar or something, or a rail or something, all right? What happened to the light? The last one is similar to the one on the left, all right? So it's a single leg stance. So you're standing on one leg on a foam, and it's the same thing. Basically, it challenges your ankles stability. It challenges your ankle muscles on how to maintain your balance with a surface being unsteady, all right? All right, next one. So these are pretty much a summary of what we just said, all right? So, but we're gonna go over with one by one, okay? So the first one is just, you know, just suggestions on how to improve your balance. Can you read, can you see it like from the back? Okay, good. All right, number one is try walking with a focus on arm swing. Okay, why is that important? Arm swing. Balance, yep. And a lot of times people forget to do arm swing sometimes, especially if you have, let's say, if you have Parkinson's disease, you know, or you're carrying, yes, you're carrying something, yep, that's true, yep. But just normal gait without anything on your hands, you should be able to swing your arm, okay? It actually propels you to go forward, all right? So it helps you. And it also forces you to do a trunk rotation, okay? Especially when you're walking fast, it would definitely will help you propel, okay? Now, number 2, walking at different speeds. Why is that important? So you can, you can challenge your balance by walking different speeds, okay? So let's say you're walking in a track, all right? Change the speed every now and then, like let's say a brief burst of like brisk walking and then slow walking again, brisk walking again, slow walking. And why is that important? Because it challenges your brain, all right, to different paces, different cadence, all right? Number 3, walk with mild head turns. Why is that important? Because when you're walking, right, you just don't walk straight like all the time. You see somebody, hi, Mr. Smith, or hi, Mr. whatever, or Mrs. Smith, right? You have to turn. And what happens when you turn your head and you're going forward? Your vision suddenly change, but your body is still going forward. So you have to learn how to do that, okay? So this is actually a hard one for a lot of our patients, because sometimes, once they start turning their head, they lose their balance, all right? And in fact, that's one of our tests that we give to the patients when we see them for therapy. I will have them walk on a pathway, and they will ask them to look right and look left while they're walking. And 99 out of 100 times, they will a little bit of a stumble or a sway. I mean, not fall, but you can see that they will definitely lose their balance, all right? It's not going to be a straight, narrow path anymore, because once you move your head, your center of gravity and your direction is going to be changed, all right? Correct. Definitely. Same thing with driving, right? Next one. Practice standing up and sitting down every day. All right. That's a good one. All right. Same thing with what I said earlier. Don't just sit in the chair or couch all the time. Practice sitting like almost like a squat. All right. Same. That's good for your quads and your glutes. All right. Number 5, stand and swing your arms back and forth to rotate the trunk. So similar to number 1, right? So like this. Exaggerate, okay? When you walk, okay? You do that, all right? You're definitely going to help rotate your trunk, okay? Number 6, this is a hard one. Try standing on one leg. So make sure you have something, you're holding onto something when you do this, okay? And again, what does it do? It challenges your glutes, it challenges your balance, all right? It challenges your quads, it challenges your calf muscles, everything, all right? It's a good exercise. Last but not the least, okay, this is good. Water exercises or aquatherapy. Luckily, in Mawa facility, we have a aquatherapy downstairs. It's a very good tool to have, especially for people who have arthritis, who have hip issues, knee issues, all right? Because water, because of the buoyancy, will help alleviate that water weight-bearing pressure on the joints. And at the same time, it also gives you challenge with your balance because of the buoyancy and the weightlessness, okay? So I really recommend aquatherapy for a lot of patients. Basically, it's a win-win, exercise, right? And it's a good exercise resistance too because of the water, right? So if you're interested, we have aquatherapy downstairs, and you can sign up for it, okay? All right. Now, when to see a specialist? All right. Number 1, if you have a history of falling, okay? Number 2, if you have problems walking short distances. Why is that? All right. It could be, number 1 could be circulatory problems, okay? It could be your breathing problem, okay? It could be nerves. It could be you have nerve problems. You have nerve damages on your feet, like numbness, okay? So a lot of times, patients who have pain on their legs, like let's say walking short distance, it's usually because due to a circulatory problem. So you have to see a cardiologist or somebody specialist to check your leg. Maybe, hopefully it's not a clot or it's not a severe peripheral vascular disease. Okay. What if you have a what do you call this? Arthritis of the knees, arthritis of the hip. So it will prevent you from walking long distances, right? Because you're in pain. So you have to see an orthopedic to make sure you're not overdoing your exercises and walking, making your arthritis worse. Okay. But at the same time, balancing it, right? Making sure that you're walking good, that you're walking enough, because otherwise, if you don't walk, you become stiff. So it's a balance. It's a balancing thing. Number 3, numbness or tingling. Okay. So if you have numbness or tingling, definitely see a neurologist. Okay. All right. Because if you have numbness, it could be due to a lot of things. Number 1, the first thing I can think of is diabetic neuropathy, right? Because of diabetes, you lose some sensation of the toes, the foot, the heel. And what happens also with that, you get pressure sores, you get wounds in the bottom of your heel that not even aware because you don't feel it, right? What else? If you have nerve damages due to back injury, all right? Nerve damages because of nerve impingement, okay? Those kind of things. Visual problems, okay? So we talked about this earlier. If you have visual problems, let's say double vision, what else? Blurry vision. That can definitely affect your balance. That can definitely affect the way you walk, okay? So make sure you always have a check with your doctor, eye doctor, okay? Make sure there's nothing going on in your eyes, okay? Dizziness or vertigo, okay? So this one, you can go to a neurologist, to check this one, or ENT, all right, to check your inner ear, okay, to see if there's something going on in your canals inside your ear. If it's like, the crystals are stuck, the crystals are, not in the right places, okay, so they can take a look at that, and they can recommend the vestibular therapy, okay. Last but not the least is ongoing pain, all right. Pain is always there. I mean, for a lot of conditions, but it definitely affects balance and it definitely affects the way we walk. All right. So we're in pain. We compensate. We tend to compensate. We tend to lean on one side. We tend to do a lot of compensatory activity mechanisms to compensate for the pain. Okay. And that will eventually lead to weakness on one side or tightness on one side, and which we don't want. So make sure you contact or consult a specialist, whether it's an orthopedic doctor or your primary doctor. Okay. Now the specialists. So I'm going to discuss 3 of the specialists that you can go to. First is a neurologist. Okay. They usually diagnose and treat balance dysfunction that is the result of neurologic disorders or neurologic impairment. Number 2. I said that earlier, the ENT doctor, ear, nose, and throat doctors, they specialize in diagnosis and treatment of balance disorders associated with inner ear disorders, such as BPPV or benign paroxysmal positional vertigo or vestibular hypofunction. And last but not the least, us, physical therapists. We are the movement experts and specializing in both gait and balance disorders. We perform tests, measures to improve the strength, stability, and movement of people with balance problems. Okay. Now, good news, in New Jersey, we have direct access. So you don't really need to see a doctor first before you can come to us. Now you can just come to us directly. We'll treat you, we'll evaluate you, we'll assess what your problem is, and then we do a plan of care, and we contact your doctor, and we communicate with them, usually your primary doctor, and then usually they sign off our plan of care or agree with our plan of care. All right. And then that way we are in contact with your doctor too. All right. Now, we have 3 locations of Valley Hospital outpatients. One is in Gopher Road in Ridgewood, 505. And another one where I work, second one, is 1200 East Ridgewood Avenue in Ridgewood, near the Duck Pond. And last but not the least is here, downstairs. All right. We have physical, occupational, and speech therapy in Mawa and the Guffel Road outpatient. But in Ridgewood, we only have physical therapy right now. But I think we're gonna have OT soon and speech at the same time. All right. So if you have any questions or any kind of you want appointment, just call us. That's the number. That's our main number, and then we'll definitely put you in the schedule, and then we can evaluate and treat you, and then we'll go from there. All right. Questions? No, it's called vestibular therapy. All right. What we do all right, the question is the crystal therapy, the one for vestibular therapy. The question is it something new? No, it's not something new. We've been doing that for years now as part of our scope of practice. In vestibular therapy, we have one in all of our facility, one here in Mawa, one in Guffel Road, and one in 1200. We have vestibular therapists who are certified. And basically what they do is they maneuver the head and then find what position will trigger the dizziness, and then trying to accommodate or kind of fix that. All right. Mm-hmm. 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 Oh, okay.
Let me start off by saying that tinnitus in my right ear for 50 years,
Mm-hmm.
and in my left ear for 20 years.
Mm-hmm.
20 years ago, I started losing my balance, which, as you described very well, you get from your feet, your eyes, and your ears.
Mm-hmm.
I was told that my ears are sending false messages to my brain.
Correct.
Which has to be compensated by apparatus.
Correct.
So that's why if you were to turn the lights off in here, I would be up. I'm carrying flashlights everywhere I go. I can't step over anything.
Correct.
I have to walk around. Can't walk on sand or grass or anything that is uneven.
Mm-hmm.
Like this. It sounds terrible that I haven't seen a doctor over 20 years about it, but I was diagnosed with what the director of oncology at Columbia Presbyterian called Dandy syndrome with osteoporosis.
Mm.
And when I tell my doctors
Mm-hmm.
that, they usually say, "Excuse me for a minute."
I know.
They go and Google
Yes.
it. But basically,
Mhm.
it's a very bad equilibrium problem.
Correct.
Which is gotten worse the last 2 years. I'm just wondering
Right.
if there's anything new around the horizon, or who you might recommend that I could see for a more recent evaluation.
Good question. So, like I said, in our facility, all three facilities, we have vestibular therapists, and usually when you come in, we'll evaluate you. We'll see what movements or what position of the head triggers it. So if it's really vestibular issue in the inner ear, or is it something else? So if it's something that we can treat, then we're definitely gonna treat you for that. And good point that you mentioned earlier. You said if you turn off the light, you kind of lost, right? Because all three systems that I just discussed earlier, all three work together. I know, that was not my doing. So those three systems, they work together, okay? So it can't be one more than the other. They all work together. So vision, vestibular, and somatosensory. So good point, sir. Any other questions? Yes. Good question. It depends. You know, if you are super unsteady and you're always falling out, you know, a lot, All right, definitely need a walker for sure. But that's the reason why you see a doctor or a therapist to evaluate you on what you really need. So sometimes patients or people forget that they can advance something, let's say from walker to a cane. All right, that way they're not completely dependent on a walker. But again, it depends on case to case basis. Some people do need a walker, some people just need a cane, but it doesn't have to be fixed for life, in other words. So you can progress. Okay. Okay. Good question. Good. Oh, we have good questions. Yeah. All right. It can be, because when you have scoliosis, this is your body when you have scoliosis. So what happens? Your center of gravity is different now. So it can definitely affect your balance. Good question. Thank you for the question. Anybody else? All right. I have another question. Yes. Okay. Oh, okay. I've heard of that, but I'm not sure exactly what it is. So he said about bifocals when you walk and then you have problems with walking or going down the steps. He mentioned about Virolux. Is that what it is? And that seems to help your issue, right? It eliminated the issue. Yeah. So that's a good point. Thank you, sir. All right. Good question. Another good question. All right. So initially, when the question is, when you walk in a walker in a gym or whatever at home, do you hold the handrail or you practice arm swing? Good question. Initially, I would recommend as a therapist, because I'm very, very cautious with my patient. I would recommend them to use the handrail for now in the beginning until they get confidence and more balance. Okay. Once you get that confidence and balance, and you feel confident, then you can try slow distance for now. Because last thing I want you to do is start walking with your arm swing. All right, you look good, but you lose your balance and game over. You're back. You have an injury in your hip, your knee, and your head. So we just don't want. Okay. Most treadmill have a safety feature that you connect to your shirt, your arm. That way, if you can't catch up anymore, it will detach and it will completely shut off the machine so you don't fall down. But needless to say, I've been to the gym a lot and I've seen a lot of people fall down, even young people, because they go so fast and they don't practice safety, and then they fall down and hit their head. And that's the worst thing you can do. Hit your head, have concussion and balance issues. But good point. All right. The question is, in the patient said, the participant said that in Lenox Hill, what the doctors did to him was they have him walking in the treadmill while reading a newspaper. All right, that's good because it distracts your brain, all right? And you keep your focus on one thing. But at the same time, a lot of people get dizzy when they read something and they're walking. Or even myself, when I'm let's say I'm in the car and I'm reading something and I look up, I get dizzy once I look up, because it's a matter of like something's moving and then constantly moving, and then your eyes are fixed on something. So it's good, and it's a good challenge. Let's put it that way. It's a good challenging for your vision and your vestibular system. It's a way to challenge but be careful when you do that on your own, obviously.
They basically said it was a coping to counteract the balance.
Correct. Focusing on something is fixed. Correct. Yeah. So he said it's focusing on something fixed and helping with the balance, right? Okay. All right. We have to see him to find out what it exactly is. It could be a lot of things. Number one, it could be something with the foot. It could be, he has some weak muscles on the legs that he's tripping on the foot. It could be a lot of other things, all right? It could be balance. It could be something that we can look at and evaluate. So again, he or she can come to us and then we'll evaluate him. If it's nothing serious, then well, we can, definitely discharge him with 1 or 2 visits, basically. All right. Anybody else? Oh, one more, last one. All right. Good question. Again, it could be part of the 3. It could be your inner ear. It could be your also your legs, because you have poor nerves. What do you call this? Like weakness. It could be weakness. All right. So it could be a lot of those 3 things: your vestibular, your muscles, your joints proprioception. Okay. So it could be all those things. All right. So you think you're walking straight, but you're not. Yeah. Could be a foot problem. Could be your vestibular problems too. All right. All right. All right. Oh, one more, last one. All right. Usually we don't give out handouts, because it's usually better that you get seen by a therapist first before you do these exercises. That way, it's safer. Because I don't know exactly what your disability or what your capability is or what your strength is. So it will be unwise for me to give you a basic exercise for everybody. All right. So it will be unsafe. All right. But it's better, like I said, you check with your specialist, the physical therapist, and they'll give you the proper exercise that you need, specific and tailored for you. All right. All right. Thank you very much, guys.
We're going to close out. So again, folks who are with us today,